Hello and welcome to Clinical Changemakers. Today on the show we have Dr. Jessica Morley. She is a postdoctoral researcher at Yale's Digital Ethics Centre and an expert in data, ethics and AI. Dr. Jessica Morley, welcome to the podcast.
Thanks so much for having me.
So I'm really excited to talk to you all about ethics and AI, but I understand that you've got a rich background in data too. And I wanted to explore for a little bit about what these generative AI, large language models actually are doing in a sense of their apparent approach to giving us information that is meaningful and that we could view them as what are called stochastic parrots, or a very clever parrot that has consumed a whole lot of information, and you ask it why the sky is blue, and it can give you that information, but doesn't quite understand why that is. And so some of that really plays on, I think, humans' brains, because we're used to, in our sort of evolutionary story, engaging with really closely to things that can act like us. We are pattern seekers, and so we can fixate on that. And I just wondered if you had any thoughts on that type of narrative in terms of describing LLMs.
Yeah, sure. So I think the stochastic parrots phrasing is very good, and it's also extremely helpful, especially in the context of when we're talking about the use of LLMs in medicine, because I think it helps to debug some of the myths of what is happening with an LLM. So if you imagine that we have an LLM based on what training data it has had access to, so that could be really high quality data, but it could also just be the complete nonsense that people have written on the internet in the past. It is then using that historical knowledge to predict what is the most likely next word in this sentence. And it just keeps doing that over and over and over again. So what is the most likely response to this? But that's all based on probability. So this is where the stochasticity comes in. You could ask it, why is the sky is blue? And probably most of the time it is going to tell you that the sky is blue, and it will maybe give you some form of explanation. But there is a possibility that at one point it's going to say, the sky is not blue, the sky is actually green, because it has maybe read somewhere that somebody has said that the sky was once green, or maybe the sky was red. Like maybe it knows that sort of red sky at night, sailor's delight type rhyme. We have to remember that that's all it's really doing, is predicting based on probability, given what it has had access to when it's training. And remember that because it means that that's all it's doing when it's giving you an answer to a medical question. If you ask, what are my symptoms? It's giving you a probability-based answer, but it doesn't understand the context in which you're asking it. And so it's quite likely that it might give you something that's completely wrong, and it might give you a different answer the next time you ask the same question. And it also isn't going to contextualize that to you. It's going to give it based on the probability, not based on your own lived reality. So I think that's why the stochastic parrots thing makes sense. If you understand that that's what it's doing. It is parroting things back based on probability, which is where the stochasticity comes in.
Yeah, and I've always found that line of reasoning very compelling. I guess from thinking and reading about that a little bit, there has been some challenges to that idea around some of the more emergent properties and sort of odd things that may signal something else going on or something more sophisticated. What's your take on these LLMs? You know, they're not explicitly trained on translation, for example, and elements of maths and you know, things like proverbs and odd things like that they seemed to still be able to consume and also output. Is that just a higher level of sophistication pulling on our brain strings, heartstrings, or is it something else?
It's definitely the same thing. It's still basing everything on a form of probability. And then don't get me wrong, they're amazing. It is amazing that that's capable of doing that. And there is some really some indication that they can be creative if you are not attaching the word creativity to anything that's emotional or meaning anything human. They definitely can come up with sort of novel insights based on the data that they have had, but it's not an insight or creativity in the same way that we would mean that to mean. There is nothing contextualized or no sort of thought in the way that we would experience that behind it. It's just going, okay, well, this based on this sequence, this is the most likely outcome. And it has access to a huge amount of data in order to have done that in the past. I think I've said this before. People got very, very excited, rightly so, from a technical perspective, when LLMs started to be able to pass medical exams. And I think my point was, well, if you gave me access to every textbook on medicine that ever existed, let me read it all and then have access to it in the exam, I probably could pass the medical exam as well. So I think we have to be really, really cautious when we're not giving too much meaning to what it is that they're doing. And I actually think that word meaning is the most important one, because I think sometimes when I or other social scientists or other ethicists talk about the word context, people think that that just means, understanding what is going on and having access to loads of different pieces of information that might understand you are in a room, you are in a university, you are in this. That's sort of what I mean, but it's also more about the sort of semantic understanding, exactly like you said in your introduction. You can ask it a question, it can parrot back the answer, but it doesn't actually understand what that means. And so therefore you can't get contextualized type of discussion because it isn't really understanding what it is. They're also incredibly tuned to please. So whatever conversation you're having with it, it is doing that deliberately to please you. And that can be quite dangerous if you're trying to have any form of fact-based conversation.
Yeah, I really like that point that you made at the end there, because I think, these tools have been built primarily in the sort of Silicon Valley zeitgeist around social media companies or within social media companies who are very good at the sort of gamblification of the dopamine hit that we're all looking for when something engages and pulls you in and draws you in, and doesn't necessarily mean that it is truth seeking, and that it is willing to push back on, a question that's completely framed wrong or anything like that. I'm totally with you on that. With what you've described, it does sound like there is perhaps a limit on how sophisticated or how much further these tools can go. I understand there is, tens of billions of dollars going into these areas, and I know AI is an umbrella term for lots of other approaches too. We've seen Meta and others, really try to put a flag on the idea of getting to AGI and other types of, next level intelligences. From what we've sort of discussed here, it does sound like there may be a limit to what the LLMs can become in terms of making the leap into something more, dare I say, conscious.
Yes, I mean, there are two important points to make in response to that. The first one is that I'm never going to sit here and claim to know what the latest development in an LLM is going to be, because I think, if we'd gone back 3 years ago, no one would have predicted that this is where we are now. But yeah, there is a hard limit. And any of this kind of notion about them becoming consciousness or developing consciousness or becoming conscious or becoming a level of intelligence that matches a human intelligence is largely nonsensical for a couple of different reasons. But the most sort of reasonable one is that it's not intelligence in the same way that we are intelligent. So humans have a very flexible form of intelligence. We're very good at responding. We're very good at learning from the environment and saying, okay, this is what's going on. Now I'm going to apply my contextual memory and respond to this type of situation. And it's all based on this understanding that we develop over time, from when we're children, to understanding how the world works and what we are going to do in it. And then we play around with it, we combine new ideas, etc. But there is some form of meaning and understanding that is central to that type of intelligence. AI, no matter how sophisticated, does not have that type of intelligence. And so it is not going to be intelligent in that way. So I think when people talk about AGI as in this idea that it's going to become something that is matching a human is utterly ridiculous. I think if they're talking about AI in terms of AGI or artificial general intelligence, I think we are getting closer to that in a technical sense with the things like agentic AI and LLMs. So basically this idea that you can have one tool that is capable of doing many different tasks. That is definitely a game changer. Whereas before we had AI where you had to have one model for task A and one model for task B and another one for task C. So if we're talking about artificial generalizable intelligence, I think we're probably getting closer to that being a reality. If you're talking about something that is going to ever develop consciousness and becoming like super intelligent that matches a human, that's not going to happen.
Can I push on the idea of consciousness and sort of moral worth? And I'm not sure if there's a line to be drawn between those two. I'm sort of getting way out over my skis here, but I am sort of imagining with these tools' ability to mimic and copy and seem to be more human, there may be a period of time in the near future, or maybe it's a long time away, where while what you're saying is still true in terms of there is not something for what it is to be like this digital tool, there is sort of moral worth put on top of it because of what it can do or what it's done or what it's perceived to do. Maybe there's a social perception that cloaks something like this. What's your take on whether? I know I'm sort of asking you to crystal ball again. I apologize, but what's your take on that line of thinking?
So I think there are different things there. Does it have worth in demonstration of human ingenuity and creativity and the capability that we are able to discover and push in the same way that music and art has worth, even though it is a static object? Absolutely, yes. Of course it has. Of course it has worth. Of course it has value. Of course it's an incredible feat that we were able to do this based on what is essentially statistics. So yeah, that has enormous worth. Secondly, is there some indication that people are capable of forming parasocial relationships with LLMs and with AI where they are infusing it with meaning and that having some kind of potential benefits in some certain circumstances? For example, there is maybe some benefits that might come from developing how we say use these things in types of therapy, or we use these things in types of people who are experience communication difficulties. Again, yes, there is definitely some indication that that can exist and there can be some benefits to that. There are also some risks and some harms, which I'm sure we will talk about later. But yes, do I think that it as an algorithmic system has any form of morality or value as an existing thing in the same way that we might put value on something else that we might consider to be conscious, for example, an animal or even plants? No, it is not living and it is not have a moral value in that sense. So I think it has moral value in the sense that it's something that we produced and it should be respected as something that was created and is very sophisticated and very clever. I think people can have parasocial relationships where they infuse it with meaning. Does it have meaning and morality as an existing thing? No.
And what I want to do is now take the conversation towards healthcare. I appreciate you allowing me to go down that chain of thinking. You've said before that AI has the potential to re-ontologize healthcare. What did you mean by that?
So by re-ontologize, I essentially mean redesign. And the way in which, or the reason I use that word and I talk about re-ontologizing healthcare is a bit like what we've just actually had this conversation is very useful grounding to asking this question. The way we are currently thinking about AI in healthcare is it's a bit like we had a physical stethoscope and now we have an AI stethoscope, and we're just going to take one out and plug the other one in. AI is much more like a systemic level transformation of the system, because it can provide us with new insights into things that we didn't know before. It can put together new forms of symptoms and say, oh, we used to think that a diagnosis of this particular condition required these 5 symptoms, but now we understand that actually it requires only these 3 symptoms, or these completely different symptoms that we never understood. So it can re-ontologize what we consider to be a disease or what we consider to be a disability by reconfiguring the different components of something that goes into that. It also allows us to flex and play with how you organize care. The simplest one, a way of understanding that, is now we have access to clinical knowledge that doesn't necessarily need to sit inside a clinician's office. So we can have people being diagnosed completely remotely and never need to be inside a clinician's office, if that is possible based on the thing that they need to be diagnosed. So we have this enormous amount of flexibility now where we can sort of rethink how you distribute care, what care even is, and what it means to be healthy. And that can be incredibly powerful and incredibly positive, or it can be dangerous if we aren't thinking about the end goal. So that's really what I mean by re-ontologizing. If you ever hear Luciano Floridi, who runs the center, he talks about this ability to the cleaving power of the digital. So it's a power to cut and paste together different concepts. So the easiest one there is cut and paste, or sort of separate the clinician and the clinic. But it also, another one that I talk about more often is you're separating diagnosis and treatment and prognostic decisions from the patient themselves. You were no longer touching or dealing with their physical body. You're dealing with a sort of data representation of that patient. So you were separating them. So that cleaving power gives this power to completely redesign the way in which we deliver healthcare, which is why it has the capacity to re-ontologize what we mean.
Thank you. And I think, right now, at least in my country, and I know in many countries around the world, it seems like we are in this never-ending health crisis where access to care is really challenging, inequitable care that's going on, the costs are rising, staff are unhappy and burnt out, and politicians and society more broadly are trying to find solutions. And putting public health as being one of those most powerful yet boring and underutilized solutions to a lot of these types of things, just focusing on what I think culturally we do fixate on is the healthcare side of things for some good and wrong reasons too. We are somewhat sort of already triggered to seek after technology, and this technology has come along at a time that people are hungry for it, including the clinicians. When we're still not even sure exactly, that it might be accurate in a paper done somewhere else, but in terms of clinical outcomes, there's a lot of uncertainty. I wanted to linger on this re-ontologizing of healthcare and what that really means. Because from what you said before, one view might be, well, that sounds great. We need a evolution or revolution within healthcare. I don't care if a system has to cut and paste my symptoms and things like that. I just want to get an answer, and to get care. What are the, I guess, traps that maybe we could be walking into if we're not thoughtful about this new powerful technology?
Mm. So I think the traps really stem from not thinking about the end goal. And so there are traps which you already touched on in terms of accuracy, validity, the fact that these things are very prone to making stuff up, they're very prone to repeating patterns that have been problematic in the past, which is often this issue with bias. You will sometimes hear people talk about algorithms being more objective than a human. Oh, an algorithm is not going to fall down the same rabbit holes of bias as a human. I'm like, well, yes, it is, because it's trained on data that was written and created by biased humans. That is a fact. So there are those types of things. But if we're talking about it and the traps that arise from re-ontologizing, this is really about we, as a community, have to decide what we think good healthcare and good outcomes and meaningful care actually means and actually looks like. Whereas what we seem to be doing at the moment is we just want to AI-ify everything, and sort of have at it, which, given the context of what you described, is very understandable. But there are things like, we know, for example, that trust and is incredibly important in the outcomes of care. People need to trust the healthcare system that they are participating in order to present. We know that there is something incredibly important and healing about the therapeutic relationship itself between a patient and the people who are caring for them. We know that things like the way the different levels of empathy have an impact on health outcomes. We also know that there are different cultural meanings of what it means to provide healthcare in different types of contexts. All of that is as valid and as important and as worthy of protection as, can I give you an accurate diagnosis at the point at which you present to me? And so if we aren't thinking about how we protect those sort of value-based aspects of care, we will end up with a system that we are not especially we don't find especially desirable. So one thing that I talk about several times, and I just give this one example and then I pause, is AI is essentially designed to predict all the time. That's one of the things that we want to use it for most often in healthcare, is predict when are people going to become unwell, in the idea that we can intervene earlier. Hopefully that will reduce demand and make everything better. That is great if we are talking about things that we can treat. It's also great if we're talking about things that stay within a relatively confined domain of clinical care. If we are talking about actually what we really want to do, which is what sometimes comes across in some policy documents, is surveil people all the time so that every aspect of their life falls within the clinical domain, because every single aspect of their life is using them to predict that they are in some way fallible, they are some way not perfect, and that is indicative of illness, and therefore they have to do something about it. I think that's probably something that we wouldn't want, because that's not something that I think most people would find a very enjoyable way to live their lives. So these are the kinds of traps that arise from the re-ontologizing power, less than just the sort of quantitative risks of accuracy, etc.
Yeah, I think, I wrote a couple of things down there. I think there is a fixation on maybe a transactional view of what health is that you have a problem and you get a solution. And there's so much sort of wrong with that assumption, because it almost assumes that we're almost at the end of medicine, meaning we've discovered everything. Every treatment works. Every investigation is without risk. And you just need to get to that answer, and then you will have solved it all. And then that other piece, which I think you've said in other places around, we are going to redefine what it is to be a good patient. A good patient listens to their algorithm. A good patient, when they get sick, it is kind of their fault, because the AIs or the tools or the information is so perfect around them that how could they not remain healthy? And so that moralizing and stigmatizing and all of those sorts of things that comes along with that type of worldview would be just absolutely horrible. I think I would be interested to hear how this then maybe puts pressure on our current institutions and organization of care, because we're still going to have some of the same, say we don't solve all of this perfectly, and we're still going to have bottlenecks on certain physical goods. We're going to have bottlenecks on access to an MRI. We'll have bottlenecks on pharmaceuticals, and we may have bottlenecks, depending on how much we trust these tools, still on trusted humans orchestrating this. And so I could imagine a sort of a two-tier system where it's people who can't afford it get the tools that are relatively okay tested, and others getting something else. What's your view on that?
Yeah, so you're absolutely right. I have talked a lot about turning people into bad patients who get blamed for their themselves becoming unwell because they didn't follow on the algorithmic advice. I think what you have just picked up on is that the risk of that happening is not equal for everyone. It is much higher risk for people who do not generate high quality data about themselves, and there has not been historically high quality data about themselves. So, somebody like me, I am obsessed with health data, but I actually don't track anything because I find it unhelpful for my own mental well-being. But in theory, I would be somebody who would generate very high quality data about themselves. But the reality is, I don't need the healthcare system that much. There are an enormous number of people who have much higher healthcare demands and healthcare needs, but do not generate high quality data about themselves, whether that be because they're already systematically denied because they don't live in proximity to care, they haven't had historically good access to care, they don't have the digital devices that generate these types of data, they are a group that is not traditionally included in clinical trials. Those people will be much at higher risk of falling into that bad patient category and getting access to tools that don't really work for them, whether because they are biased or whether because they are just given things that are lower level accuracy because people assume that something is better than nothing. And you do start to create this two-tiered system, and which I sometimes have referred to as the inverse data quality law. So as I'm sure everybody is familiar who's listening to with the inverse care law, and this is basically the data law. So the availability of high quality health and care data varies inversely with need. And that's the thing we've got to pay a little bit attention to.
And I was reading one of your recent papers when you did the relook at sort of papers since I think 2019, and there's a line in there around it not being clear if the impact of AI is ethically justifiable. And I'll be honest, it sprung in my mind the sort of Jurassic Park quote of, you scientists were so preoccupied whether or not you could, you didn't stop to think whether or not you should.
You should.
And so that sort of touches on sort of ethics, and perhaps a bit of law, and I'm not sure if there's philosophy bridging some of those areas. I wondered if we could, before going into some elements of your paper, just maybe spend a moment talking about some of those differences between ethics and law. Because one argument is to say, well, we just need smarter policies and more legal frameworks, and I think that's probably part of the puzzle, but it's not the whole thing.
No, absolutely. So that Jurassic Park quote is kind of perfect for differentiating between the two concepts, because the law is could, whilst ethics is should. If you are simplifying things to a great degree. Again, Luciano has said before it in a slightly different way. The law is the rules of the game, whereas ethics is how you win. And well, sort of essentially the thinking behind both of those things, and they're both slightly trite, but they get the point across, is that the law is relatively inflexible, it's quite slow moving, and it really is the floor. So it's like, this is the bare minimum. But we often need ethics, which comes from societal expectations and norms, and it does come from some philosophy, to think through the more contextualized nuances of that and how it might change over time. If you look at how things have changed historically, things that we would consider absolutely abhorrent now would have been legal in the past, but what changed them and made them illegal was because ethical justifiability. People started to realize, do you know what, it's not particularly ethical to do this. Clinical trials is a really great one, and the differences between informed consent, that all comes from ethics. It wasn't from the law, and so we need that sort of next level of thinking in order to contextualize. So even if something is a rule, you can do this, that might not mean that we want to do this. This happens a lot in the data space in health. So, for example, there have been a couple of UK cases where there was a big one a few years ago called care.data, where the UK government tried to make a massive database of everyone's electronic health records and then give access to them for researchers. That was perfectly legal. What became very apparent was that it was not socially acceptable and people didn't think it was ethically justifiable, and the whole project fell apart. So you've always got to have both. Otherwise, you'll end up with something that's too inflexible. That inflexibility is a problem both in terms of time, because things shift and change over time, and in terms of cultural expectations.
I'd like to linger a little bit on those failures around the NHS, because I think, globally, technology transformations and changes can be fraught. One for, as you say, the sort of social license side of things. The other is, I think, actually getting the outcomes that you sort of hoped for. That often it's quite hard to tell, or at least to measure. What was going on? What were maybe a little bit more detail on maybe the elements, that issues that maybe accrued, lessons to learn? Because I think there is maybe something that's going around in the idea that this time it will be different, because the technology, has this nature to it that this will be different. It's a consumer product already. People are using it for other applications. All of this point of difference. What would you say the bigger lessons are, and how you maybe get that social license, but also bake in the ethical frameworks that are required?
Hmm. So the sort of simplest takeaway is don't make assumptions. So those things that have gone wrong with the NHS in the past, and they have repeated the mistake several different times. So with care.data, they also repeated almost the exact same mistake in 2020. It comes up again and again. But the fundamental issue was the government was making an assumption that because the NHS is a public good, they see it as a belonging to the public, everybody pays into it, everybody benefits from it. Therefore, if we provide public access to the database, then you get public benefit from that. That's probably going to be fine. That was sort of the large assumption. And there seems to be, I think, some of that assumption going on in the sort of Wild West development of AI that is happening at the moment. In fact, we've seen a couple of cases in the UK where it has happened with AI. They're like, oh, it's absolutely fine if we just sort of take the throw the spaghetti at the wall approach, because some good might come from that. The issues with that and why it failed was you forget about everything else. People still care about privacy. People still care about who has access to it. People still care enormously about sharing of profit. So there is a big thing in the UK, but it's very similar in other places that have a sort of social insurance-based healthcare system, where that what they really, really are uncomfortable with is this idea that a private company comes in, develops an algorithm off data that was generated by everybody, and then they go and sell it to America, where I am now, and that company makes profit, but none of the people whose data were ever involved in that ever actually saw any form of benefit from it. And we do not have the ethical frameworks in place at the moment for dealing with these types of complexities. So in terms of how you do that, it's really just avoiding the cart before the horse problem, right? Don't go slow. Essentially, we have to put some friction in the process, make sure that when these things are being designed and people are making decisions right from the get-go, that you are engaging with society, you are talking to people, you are making sure that patients and publics and even practicing clinicians are involved, and we have difficult and awkward conversations about what it is that we want to achieve. You are never going to get to a world in which everybody is happy, but if you never pause and put friction in the system to develop that type of thinking and do proper engagement, you will also never end up in a solution where anybody is happy.
And I understand that you also did some work at OpenSafely, and that was obviously quite a success. So what was different there?
So with OpenSafely, there were two things that I think were crucially different. The first one was that it was designed with all of those lessons about privacy, etc., in mind. So part of the problem that had happened with things like care.data, but with other similar things, is that they'd never considered how do you technically mitigate some of the risks that people find ethically unjustifiable. OpenSafely did that from the start. So the electronic health records that OpenSafely has access to never move from the place at which they are stored for the purposes of care. They stay in that location. And OpenSafely is a software platform that allows researchers to have access to that data, but the researchers never see it. They write code over here. They test that code against fake data, synthetic data. Once it works, they send the code to the original data where it is stored by the electronic health record providers. And then what they get back is the results. The results then sit in a sort of airlock type system where people will go in and check them, called output checking, to make sure that there's nothing that might be, I don't know, privacy infringing if it was a very small number, but other things too, like maybe the result appears discriminatory and we might need to think about that before it is released. So that's kind of part one, is that it technically made things a lot more secure. The second thing was it also builds in, from the start, transparency. So people often misinterpret transparency and think it's just about putting a privacy notice on a website. Whereas it actually means, can people query and understand what's going on? And so OpenSafely has an audit trail built in. So you cannot run any query on OpenSafely at all without that being logged and it being logged in public. So anybody at any point in time can go in and check what the data has been used for and who had access to it. And there are systems in place if somebody was using it for something that was not pre-approved, would immediately get shut down. And so that stops this problem, which has also happened before, where people have sort of been given carte blanche access and then they go and do something that was very ethically unacceptable. A classic example would be when people were given access to genomic data and they went looking for the gay gene. That is a bad idea. No one should have ever had that happen. But because the researchers had pre-approval to use the data, they went ahead and did it. Terrible idea. And then the third reason OpenSafely worked was we were quite radical, and the way in which we involved patients and public from the beginning. So we had a group of people, they're called Digital Critical Friends, who we did like 6 weeks worth of training with, and then they were involved in all of the decision-making processes of how OpenSafely runs, how it's technically designed, all of types of things. We also involved in a big citizens jury where we really tested some of these ideas. So at no point was anything a surprise to people. So like those three elements, technical design, really clear in terms of transparency, and involve people from the beginning in all of the decision-making process.
It's really helpful. I think what I was thinking about there is sometimes these additional considerations can be viewed quite negatively in terms of cost, resourcing, time, effort, basically. Um, but from those examples you've given, these are the kinds of success factors that you need because of our, historic and very recent failures in these sorts of things. And I think from the re-ontologizing space to the technical failures space, there is a real risk, even if you're just a pure techno-optimist, to start to lose the trust and the momentum and the faith of people, and then the money starts slowing down and the contract starts slowing down and the whole, the whole mission gets compromised. If we aren't doing these things well and recognizing that people still need to be at the heart of the decisions and the designs and supporting those outputs.
Yeah, absolutely. I mean, there's a more mercenary way of looking at all of this, which is essentially you don't want to spend a load of money on a product that people then end up not wanting. And so, yes, maybe it is going to cost you more. Maybe it's going to be more effortful in the development process to do all of these types of steps that I am describing. But there are also risk mitigation steps for you. There are also steps that help it make it that you don't develop and launch something that then massively damages your company's reputation, your research institution's reputation, and ultimately hurts your bottom line and prevents you from getting a return on investment because people didn't want that. Now, there are multiple parallels of that having happened in the past, particularly with clothing makers. But you also had the things like the big anti-swoosh movement, which really impacted Nike. There are all of these parallels where we have seen it happen in other industries. That is also what is happening in the health data space. And those industries learned, yes, not all of them, of course, there's still all sorts of things going on, but by and large, learned, okay, yeah, maybe it's really going to cost us some upfront investment in developing these types of mechanisms that make people happier, but it's better off in the long run. I don't especially like that mercenary type of framing of these types of things, but if we're going to come down to it, and if that's how you're pitching it to a board, that I think is the way that you've got to try and make the case.
Yeah, and I think as well, sometimes we forget or we under recognize some of the globally complex coordination problems we've had in the past, things around the ozone
Yeah.
hole, things around international space treaties, um, the Kyoto Protocol, these things that seemed impossible until they weren't, right? And that it just required, consistent, persistent pressure until, there was the right, snowflake landing on a avalanche that kind of caused this to occur. Um, Having said that, the global policy environment, looking at the UK and the US, China and EU, all seemingly, from my limited vantage point, sitting at some different extremes, perhaps, of the policy space. And maybe 5 years ago or longer, there was always a conversation around safety, and now, at least in the US and perhaps elsewhere, there's more of a let it rip type of competition based approach. What's your view on what the kind of global political environment is to foster some of these ideals that we're trying to champion?
But it's very, very difficult at the moment because the whole sort of geopolitical space in this is very fraught with tension and it's pulling in multiple different directions, which you mentioned. The EU has gone this way, and the US and increasingly the UK have gone this way, and China is sort of a third way on its own. But the EU has been very pro-regulation and pro putting quite hard limits on things, which is what has happened with the EU AI Act. And there is also ethical things built into the EU AI Act. The UK was, before it decided to make the slightly irrational decision to leave the EU, more aligned with that line of thinking, and now it is more aligned with the US type of thinking, which is more pro-innovation. And this idea that regulation is bad for innovation and all we want to do is build, and make things. Those two extremes create a view that there's a bit of a false dichotomy, that you either have regulation and protection of the public, or you have innovation and fast moving and the sort of move fast and break things type of attitude. The reality is you need both, and you can design the system to allow for both. So that's why the EU has got things like regulatory sandboxes, which will allow people to experiment outside the scope of regulation before it is launched to the public. I think the sort of, as you say, let it rip type thing will ultimately backfire, because the risk is you create what's called chilling effects, which is largely what we've been discussing. We just haven't put a name on it. This idea that you do something too fast, it launches, it backfires massively in terms of the public response or in terms of things like effectiveness or anything like that. And it dampens people's enthusiasm for the whole concept, because they go, oh, we don't want to do that. So it is much better to sort of have this halfway house where you design regulation with a sufficient degree of flexibility that it doesn't stifle innovation. That also gives security to companies, because companies do not want to develop something, and researchers don't, that ultimately ends up being outside the law. That is a huge risk in terms of their ROI. And then if we're going to put this mercenary label on top of things, or sort of mercenarily view on top of things, we will have to, at some point, get to a point where there is more, especially in health, international agreement, because nobody really has the capacity in terms of the data, the technical skills, and the underlying infrastructure to design everything that they need in-house. So things will have to move across borders. And unless you have some degree of international interoperability with the rules, that isn't going to work. At the moment, we're a bit of a long way off that, but hopefully it will happen.
Yeah, I like that you also mentioned the interoperability, because I think there's something at the base of these tools. If we're going to truly unlock their potential power, it's around having super high quality data that is representative and that and interconnected appropriately. And I think there is some foundations that I think we can't lose sight of if we're going to realize some of those sorts of things. I also liked the idea of these false dichotomies, and I feel like they're kind of everywhere in the space. And I think I've spouted a few of them from the idea of, would you rather no care or some care by a chatbot? And I think that is something interesting to wrestle with, but actually it is not the reality we live in, because the question comes back to society: is how many doctors and nurses are we choosing to train or not choosing to train? How are we creating food environments where it's affordable and accessible to get healthy food, and culturally and socially acceptable, and all those sorts of things? And so in some sense, I feel like in these things we really need to push on our imagination to look for another way. When we're talking about regulation, viewing it as an enabler. You would hate if every time you go to fill up your car, there was some proportion of water that gets in your car because it was unregulated, and we weren't going to try to find a new way for managing poor quality control at the pump. And then there's things around practices for contracts and what am I paying for? What are you giving me? And then what is that relationship ongoing? So, these technologies, as they change and morph and adapt and what have you, um, the kinds of relationships we can have with them in healthcare and other industries is going to be a more longitudinal one, which is going to require more ways of managing that quality and that expectation. And so, yeah, it just feels like we actually do have a lot more levers that we're giving ourselves credit for, but they're just not as exciting, perhaps as arguing about the intersection between health and care and things like that.
Yeah, absolutely. I mean, that's exactly it. I mean, I think one of the things I sometimes do is say what AI is and what AI isn't. And I say AI is not magic. It's not new. It's not intelligence. It is very powerful and it is controllable. Um, and we have all of the tools available to us in order to put those kind of controls on it to shape it in a way that we want it to achieve. You talked about contracts, but there's procurement. Um, there's also thinking things through in terms of liability. What does negligence mean in these types of contexts? There is how do you do profit sharing? How do we manage IP? How do you deal with the data exchange and the infrastructure? All of that type of thing. Which is what I sort of mean when I say friction and build slowly, is what I mean. We need to put all of those roadblocks in place, at least at the same time as going sort of, oh, let's build whatever we can in order to make sure that we get the outcomes that we want. But it is so non-sexy to have those conversations when what people want to talk about is the exciting tech and, oh, look, this thing now diagnosed at a higher rate than a doctor. So, well, what does that even mean? What doctor, in what context, how many years of experience does that doctor have? What type of patient were they seeing? All of those are questions that are boring because they don't translate well to the public narrative. So there is also something about how we, as people who want to protect all of those things, also think about how we communicate the importance of it so that those conversations become, if not as exciting, at least as prominent as the ones about what the tech is capable of doing.
Yeah, I was just thinking about roadblocks and sort of getting the language that helps to recognize that this is a partnership in terms of we all want better health for everybody, and how it's maybe it's not a roadblock, it's a speed limit, right? And until your car has proven it could not fall apart past 50 k's, we're just not going to let you go any faster, and that's good for you because you're going to be able to sell more once you can get to the next speed limit area, and it's good for the people who are driving in it, etc. I think the other thing is asking people when we're talking about deploying these kinds of tools is, would you use it yourself? Would you use it on your mother? Would you use it on your best mate? Because there is something othering about, we're doing this for you. Just don't worry, you'll be fine, and sort of bleeds into some of the middle and low income type of ways that we treat and lower the bar for people in our broader society, because we say something's better than nothing, and that is a very dangerous viewpoint. I know that you've been doing a lot of traveling, and you live and breathe in this sort of space. What is the kind of sentiment across the globe when you're talking to people about these kinds of things? Is this something that is well understood in the places that you're going, or is there still a lot of the sort of technical optimism viewpoint that's pervading the conversation? What's your sense there?
It massively depends on who you're talking to. So if I'll I'll give you obviously this is a hugely crass generalizability, but for the purposes of simplification, when I talking to policymakers, and also big tech companies that are primarily tech companies, not healthcare companies. So they're first and foremost a tech company, not a healthcare provider. Those category of people, I think, are at the moment overly enthusiastic, and very focused on the hype. So they do not necessarily get the type of thing that I am talking about, or the types of things that we've had in this conversation. They especially do not necessarily engage with the point that you made right at the beginning, which is about this public health dimension and the fact that there are roadblocks. Like, sometimes I think there's this little bit of a narrative that exists in that echelon of people, that if we can just predict everything, nobody's ever going to get sick. And it's like, well, people are still going to get sick unless you also fix all of the things that are causing people to get sick in the first place. And that means you've still got to invest in all of the non-digital, non-AI things that enable people to be well. Like, as you mentioned, access to healthy food, access to exercise, access to sanitation, all of that type of stuff. So there's limits there. I think when you talk to people who are closer to healthcare and people who understand the complexity of it and understand the nuances of it and understand the importance of all of the other aspects that we have discussed. And so that might be healthcare providers, but it's also often researchers who have closer links with healthcare, and even companies that are healthcare companies first and technology companies second. There is a much greater understanding of and welcoming of this sort of narrative, and there's a lot more caution. So there's a lot, and that caution is helpful caution. Sometimes I think healthcare institutions get a bad rep for being slow to adopt, and it's like, well, they're not being unnecessarily slow or Luddite-ish. There is a caution of, what do I want? Is this safe? Is this good for me? Is this good for my patients? And there is therefore, I think, more willingness to find a balance in that regard. So exactly like you said, it's not necessarily, do we do everything with a chatbot or nothing with a chatbot? But it might be, what types of tasks and what type of people is it okay to defer some of this to a chatbot? Now, then with patients and the public, there is a big split, and I think that split is largely related to digital literacy and digital health literacy. So people who have some more of an understanding of how these tools and these technologies work, I would say, are largely in the middle ground, of, yes, we want this type of stuff. Yes, we can see the benefits of it, but maybe I don't want to always only be talking to a bot. Sometimes I would like to talk to a human. And I probably don't want to get push notified that I am at risk of this without ever having had a conversation with somebody before. I think people who are have lower levels of digital health literacy and lower levels of digital literacy are more vulnerable to both the extremes. So they're more vulnerable to believing the hype and thinking, this will solve all of my problems. I can ask ChatGPT what's wrong with me, and I don't have to think about that. And they're also more vulnerable to believing, sort of scaremongering, that this is the replacement of clinicians and you're never going to see a doctor again. And so you get these layering effects, I think, depending on who you're talking to.
Now, as we sort of wrap up, I know that you've described yourself as a skeptical optimist.
Mm-hmm.
I want to spend a moment on the optimism. What do you see as optimistic? What are you seeing that is the potential of these tools?
Two things. One, I think it is a phenomenally powerful research tool. And there is, like you said at the beginning, sometimes we have this impression that we've reached the limits of medicine or we've reached the limits of health. That is not true. There are so many things that we don't understand. There are so many things about public health that we don't understand. Okay, we know that if people drink contaminated water, that's going to be very, very bad. But there are loads of other things that we don't yet understand, how these different factors interact and mean that some people are predestined to be healthier than others, and this whole stuff about postcode lotteries and all of that. Now we have mechanism to start dealing and digging into that. And as a scientist and as a nerd, I think that's extremely exciting. I'm very optimistic about that, because it also opens up a whole window into a load of different things we can do. We can do modeling. We can look at different types of interventions. All this super crazy, really boring, really nerdy stuff. I'm super optimistic about that. I'm also very optimistic about using AI to do things that we have not done historically very well in healthcare, which is often in the back end stuff. So predicting when we might need staff, for example, and at what point do we need certain types of staff and a thing. Doing things like performance monitoring, looking at how you optimize patient flow inside a hospital or optimize the utility of an operating room. That kind of thing, really also very optimistic about. And assuming you're going to ask me about the skeptical, so I pause. But those are my two things I'm optimistic about.
Yeah, that's great. I mean, I think there is something in institutions and governments to learn from that. That actually you can go slow in the critically high risk, clinically orientated, patient facing avenues, and then there's an opportunity to perhaps go a little bit faster in the sort of operational mechanics of how you kind of work the back end, as you're saying, to make things happen. Vastly lower risk type of environments, but also still, make the machine run, right? If nobody's getting paid on time and nobody knows if they're on shift, then that becomes a huge problem as well. So yeah, sure. Tell me about the skepticism.
The skepticism is also twofold. The skepticism is, I'm skeptical that AI is just going to let us do things that we already do faster. I don't think it necessarily will, because of all of the things that we've already spoken about. Similarly, I don't think it's necessarily going to make us do everything better because of all of the things that we've spoken about. And then the other reason I'm sometimes skeptical is because of political power, and that wanting to go in one direction, and the quieter voices of us wanting to go in another direction do not necessarily have the might to shout over the louder voices. So sometimes that makes me skeptical, but it doesn't outweigh the optimism.
All right. Well, this has been a fantastic conversation, Jess. I've really, really appreciated all of your insights. For the listeners, definitely give Jess a follow on LinkedIn. She writes some really great posts and some research papers, which I'll link in the comment section. So just a big thank you, Jess, for your time today.
So thank you. It's been good fun.